Good morning. We're on with Dr. Jeffrey Thompson, our premier cardiologist and medical director this morning. We're just going to have an informal discussion to try to answer some questions that have come our way and give you guys in the Facebook group a better understanding of risk factors that we're looking for, how to dig a little bit deeper as a practitioner, and what we can do from an application side to mitigate those. So, Jeff, good morning.
Good morning.
I know we first began our discussions with the vital scan that we've been doing for a bit now, and the value of that test. You know, to me, it seems like a really good broad spectrum analysis to show us risk factors in the areas of cardiovascular health, microcirculation and neuropathy, mostly from diabetes, risks for stroke and sudden cardiac events, inflammatory conditions. But you know, when we do those tests and we get those reports and we do a report of findings with patients, it's not infrequent that we see cases that need some further and deeper study. So that's where I kind of pass you the baton, and you have the technology and the knowledge and the resources to take the steps further that we need to do in order to get patients to really know their risk factors and what they can do about them. So first of all, I guess, you know, there's several areas that you fall into. You do some really deeper work on lipid profiles and fractionation of cholesterol and things like that they won't see at their normal doctor. So I'd like to discuss those a little bit. And I know that we use Cleveland Heart to do that. So I guess, first of all, what do you get out of those that really are of value of you from a therapeutic side to the patient that they won't see just going down to their local lab and getting a HDL, LDL, total cholesterol done?
Well, Eric, thank you for this conference. The important thing to know is that atherosclerosis, plaque in the arteries, is really an inflammatory condition. These lesions, these plaques, these quote unquote blockages, they all start in very infant stages, even with noticeable changes in the vessel in infancy. So we're born with plaque development in the arteries of the heart and blood vessels of the body. And it's important to know that changes in that we note in your testing are really the early signs of plaque development in the arteries. We're not looking necessarily with our partnership with Compass at changes that are at advanced stages. We're looking for the earliest signs of cardiovascular disease, and that tends to involve molecular analysis, tends to involve advanced cholesterol testing. It tends to involve performance of microvascular structures that are not indicative of advanced heart disease. But in terms of where we look, we're really looking at infant stages of cardiovascular disease, which is where the identification and treatment ideally should take place. If you look at the example of, say, fire safety, it is much better to look through a building to look for potential areas of fire risk than it is to have the whole crew go in with the roof coming down.
Exactly.
We absolutely have at our disposal those treatment protocols when the disease is at its advanced stages, and we are able to have good outcomes even at those stages. But for overall cardiovascular wellness, it is ideal for patient outcomes and quality of patient life to to simply identify and prevent disease at its infancy. That is kind of the overview of what we're all about. We incorporate testing that we're in many cases the only providers in the state or New England region to show these early signs of cardiovascular disease. And the partnership with a weight loss specialist is invaluable because all along the way, lifestyle modification is completely essential in fighting heart cardiovascular disease, which in several cases is preventable.
Yeah, and that's obviously our wheelhouse. You started off your conversation with the importance of inflammation. And, certainly there's enough danger in the buildup of plaque and things like that. But it's really the inflammation and the condition of the endothelium that sets people up for these kind of events that we're both trying to avoid and get into in the prevention stage too. But if, let's say, somebody is a little bit more advanced, and you have to, when we try to do things with lifestyle changes and dietary changes and things like that, but if you have to resort to meds, we've had this discussion in the office. Even when you get into statins, doctors will maybe indiscriminately prescribe a statin without really knowing what statin to prescribe for what particular patient. So can you dig into just maybe a little bit deeper as to how you make decisions on what statins to use in particular patients?
Well, excellent question. And see, the thing is, we have to decide in which patient to actually truly use a statin. We call them statinize. Uh, and the underutilization of statins is an issue in preventive cardiology and in general medical practice. The literature showing the benefit of statin use could fill 6 or 7 buildings. As antibiotics in the 1940s of penicillin, etc., were influential in treating infection and prolonging lifespan. There also has been a increase in lifespan in the 90s, 2000s, and now with the utilization of statins for the treatment of cardiovascular disease. That being said, not everybody needs a statin, and not every statin is correct for every patient. Uh, there are genetic ways to identify which patients will respond to which statin and tolerate it just fine. So this is the whole nature of functional medicine and customization of treatment for the patient's genetic background and family history especially.
Yeah, and we've even discussed things as far as prior to assessing the need for a statin, there's more natural ways to get some of this stuff done. The high dose time release niacin that you talk about, fish oils, EPA, DHA mixes, those have a place in this kind of a treatment regime too, do they not?
Absolutely. You can open the bottle of the statin in the room and get the vapors, and you'll see the cardiovascular risk go down. It's amazing. We're talking about risk lowering of statin use of heart disease in the 33-40% range. However, there is residual risk, and how is that risk best treated? There are several medications and several natural substances that are healthy to the cardiovascular system. Niacin is a vitamin. We happen to use it in very high doses with no risk of patient safety to promote healing of the cardiovascular system. There are other natural substances, berberine, grapeseed extract, Fish oil is notorious for cardiovascular wellness. There was a study in the 1980s in Italy with fish oil use, which prevented sudden cardiac death. The 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 estimation of how much benefit uh, the fish oils and other natural substances provide is that they do increase, they do lower risk beyond what a statin can produce.
Hmm.
Um, the these are underutilized treatments, and we follow basically the cardiovascular science without bias. There is a bias towards pure natural methods. There's a bias towards pure pharmaceutical methods. We at the Center for the Healthy Heart want to find where the science leads and use those integrative approaches for cardiovascular wellness.
Great. And when we do natural therapeutics like this, like in the fish oil, for instance, we look at ratios of EPA to DHA and get the optimal ones. We also look at ratios of omega-6s to omega-3s, which is in the Western diet way out of whack and very inflammatory in nature too. So there's a lot can be done just on the dietary and supplement side before patients ever have to get to the statin place or the pharmaceutical place. I teach patients at some points about the dangers of proteoglycation and things like that, and how to cook your foods and how to prepare them to make sure that we don't get the binding of sugars to proteins that are a major component in this inflammatory cascade that creates the LDL that's going to set the patient up for these kind of events where they get clots and blockages and emboli. So there's a lot of nutritional and kind of lifestyle things that can be done before they ever get to that point. One of the other things that really more lately has kind of piqued my interest, and we've dug into it pretty deeply, is, as you know, the optimization of nitric oxide. And this is probably the body's most potent tool, natural tool in vascular tone and reducing blood pressure and maintaining the health of the endothelium. Do you have specific ways that you try to balance this? Because I know in our practice, we use things like L-citrulline and beetroot and other things that raise nitric oxide, which is really tough to measure. So you have to measure precursors in order to know that you're getting the job done. But does this interface with your practice?
Yeah, nitric oxide is really the central molecule for vascular health. The difficult and complicated nature of nitric oxide is that there are several pathways and disease processes that will affect the nitric oxide levels and the way the nitric oxide interacts with the blood vessels. Um, the short answer is a combination of integrative involving alternate, we'll say, natural methods and some pharmaceutical methods really give the nitric oxide the biggest boost. Um, and in fact, this extends even into the genetic realm, and the fact that nitric oxide availability and aging is important. Development of hypertension, these sort of things. For instance, we at the Center for the Healthy Heart will investigate the genes of cardiovascular disease because those are very important in the process. And in some instances, the genetic, not profile, but behavior of the genes can be altered with substances such as resveratrol.
Mm-hmm.
Uh, so we are interested in not just the genes to identify risk of heart disease. How we're interested in whatever modification we can implement to affect the performance of those genes.
And that's where
So,
epigenetics all kicks in. Yeah. So listen, ever since we've met, I've been intrigued about how we interact, and it's not that common to find a top level cardiologist who integrates with somebody in my realm, and things fit into a nice puzzle arrangement. And you have things to offer that we won't, and hopefully we have a few things to offer that you don't. But it's a great synergy, and I'd like to take this opportunity to thank you for your participation. And I think we've overwhelmed our patients enough for one day, but maybe this can serve as a good primer for future interviews to come, and I would look forward to it, and I'm sure my patients would too.
Well, you've been very gracious, and I thank you for really focusing on wellness prevention and lifestyle to lower cardiovascular risk. That is the most overlooked aspect in the fight against heart disease, and cannot be, you know, cannot be taken lightly because it really is a multifaceted approach.
And thank you for the same and more, and I'm sure there's much more to come. Have a wonderful day, Dr. Thompson. Thank you so much.
Thank you. You as well.
Take care.